Hi, good morning, Collins. My name is Mihiraa. Let's start the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
Your preparation time is over. You can now start your role play.
Hello, Mihiraa. Good morning. My name is Collins Coulthard, and I am one of the ward nurses looking after you today. I am really pleased to see how well you are recovering from your deep vein thrombosis over these past few days. As your discharge is approaching in just a few days, I am visiting you today to go through some essential self-injection training for the blood-thinning medication you will need to continue at home. Before we get into the details of the training, could you tell me how you are feeling about returning home soon?
Good morning, Nurse Collins. Thank you so much. I am definitely relieved and happy to be heading home soon, but I must admit I feel a little nervous about taking care of myself, especially when it comes to managing injections on my own.
It is completely understandable to feel a bit anxious about managing injections on your own, Mihiraa, and it is very normal to have those thoughts when transitioning back home. Please rest assured that we will take this step by step today so that you feel fully confident before you leave. To help you understand why this is such an important part of your recovery, I would like to explain the necessity of this post-discharge anticoagulant therapy. Continuing this medication at home is crucial because it prevents the deep vein thrombosis from worsening or reforming in your legs, and it maintains therapeutic blood thinning to keep your blood flowing smoothly. To begin with this topic, what do you already know about subcutaneous anticoagulant injections?
Thank you. That makes sense. I know that the medication thins my blood to stop clots, and I know subcutaneous means it goes under the skin rather than into a vein, but I have never actually given myself one, so I don't know the proper steps or technique to do it safely.
That is actually a great baseline understanding, Mihiraa, and you already grasped the core concept of subcutaneous therapy very well. Now, I am going to introduce and explain the exact preparation and injection technique, so you know step by step how to do it at home. First, preparation begins with performing thorough hand hygiene by washing your hands well with soap and water. Next, you will select an appropriate site, such as your abdomen, avoiding the area right around your belly button. You will then pinch a skin fold gently between your thumb and forefinger and insert the needle cleanly at a 90-degree angle. Once inserted, for the post-insertion steps and removal, you will depress the plunger fully to deliver the full dose. Hold the needle in place for a few seconds to ensure the full amount is absorbed. Gently withdraw the needle, and finally release the skin fold.
Okay, I am following along so far. Washing hands, pinching a fold on the abdomen, going in straight at 90 degrees, pushing all the way, holding briefly, and releasing after pulling the needle out. That sounds manageable, but does doing this repeatedly cause skin problems or bruising?
I really appreciate you asking that, Mihiraa, as it shows you are paying close attention to your care. That leads us right into our next step, where I want to emphasize some key safety guidelines to keep your skin healthy and prevent complications. To prevent tissue damage and bruising, it is vital that you rotate your injection sites each time, moving to a different spot on your abdomen rather than using the exact same location repeatedly. Additionally, once you withdraw the needle, please do not rub the site post-injection, as rubbing can irritate the tissue and increase the risk of localized bruising. Having gone through these safety points, what concerns or questions do you have at this point?
I see. Rotating sites makes a lot of sense, and I will make sure not to rub the spot afterward. I don't have any major concerns about that now, but I am wondering where I should store these pre-filled syringes at home and how I ought to throw them away safely after use.
Those are crucial practical questions, Mihiraa, and I am glad you brought them up. I will now educate you on proper medication storage and Sharps disposal guidelines. For medication storage, you should keep your pre-filled syringes stored at room temperature, making sure they are kept away from direct light and heat sources like windowsills or radiators. For Sharps disposal, you must use a dedicated yellow Sharps container that we will provide for you. You need to dispose of the used syringe immediately after administration without trying to recap the needle, following these safety precautions to protect yourself and anyone else in your household from accidental needle stick injuries.
That is very clear. I feel much more comfortable with all of this now.
You are doing wonderfully, Mihiraa, and your understanding of each point is excellent. Now that we have covered the purpose, technique, safety rules, and disposal, the next step is for you to put this into practice. I would like to establish your consent to observe you perform a supervised practice injection right now, so you can get hands-on experience while I am here to guide you. Would you be comfortable attempting that now? How does that plan sound to you?
Yes, absolute consent from my side. I feel ready to give it a try under your supervision, so I can practice the technique properly.
That is wonderful to hear, Mihiraa, and I am right here to support you through it. Before you begin your practice injection, let me briefly summarize our whole discussion to ensure complete clarity. Today, we confirm that continuing your subcutaneous anticoagulant therapy at home is necessary to prevent DVT recurrence and keep your blood at a safe therapeutic level. We walk through the technique, washing your hands, selecting an abdominal site, pinching a skin fold, inserting the needle at a 90-degree angle, depressing the plunger fully, holding it for a few seconds, withdrawing the needle, and releasing the skin fold. We highlighted safety measures like rotating injection sites and avoiding rubbing the skin afterward, and we covered storing the syringes at room temperature away from heat and light, followed by immediate disposal in your dedicated sharps container. You have grasped every point brilliantly, so let us proceed with your supervised practice.